In the last part of this series, we will briefly touch on 3 very important and serious causes of pain. And finally, I'll give you a 4-step plan to stop your pain. Discs are the pads between the bones that act like cushions. These cushions allow movement between the bones, and this in turn gives us flexibility. This freedom of motion is a wonderful thing, but it can be a double-edged sword. You see, discs can be a source of debilitating and unremitting pain as well. Don't worry, we're going to keep this simple. This is a picture of 2 discs looking from the top down. Think of the discs in your spine as jelly donuts because your discs have a jelly center and a tough outside. In the picture above, think of the pink area as the doughy outside of the donut and the white center as the jelly. The jelly should always be in the center of the donut. Why? Because when the jelly is in the center of the donut, or in this case, your disc, you don't have any pain. If the jelly pushes against the doughy outside of the donut, you have pain. Simply put, jelly inside the donut, no pain. Jelly pushing against the outside of the donut, pain. The person on the left has no pain because the jelly is in the center of the disc. The person on the right has pain because the jelly has pushed against the outside of the disc. In the case of the person on the right, they probably also have leg pain because the jelly has pushed so far away from the center of the donut that it is now pressing on the nerve. It's easy to see how important it is to treat the disc when you have low back or leg pain. In fact, there are a growing number of authorities who feel that much of today's back pain is caused by the disc. I agree with them. And for that reason, I usually treat the discs of my patients who have back pain, hip pain, or leg pain. Don't get nervous. We're going to keep this simple. This is a picture of 2 discs, looking from the top down. Think of the discs in your spine as jelly donuts, because discs in our spine have a jelly center and a tough outside. The important thing to remember is that the jelly should always be in the center of the donut. Why? Because when the jelly is in the center of the donut, you have no pain. If the jelly pushes against the outside of the donut, you have pain. Simply put, jelly inside the donut, no pain. Jelly pushing against the outside of the donut, pain. In this picture, the person on the left has no pain because the jelly is in the center of the disc where it should be. The person on the right does have pain because the jelly is pushing against the outside of the disc. Simple. In the case of the person on the right, they also probably have arm pain because the jelly has been pushed so far away from the center of the donut that it is now pressing on the nerve. The jelly doesn't need to be very far away from the center of the disc to cause you pain. Therefore, I always treat the discs of my patients who have neck pain. While trauma from accidents can cause your disc to move out of position, it's important to remember that poor posture can cause it as well. While trauma from accidents can cause your disc to move out of position, so can poor posture or extreme exercise. Stretching is both good and bad. This young lady obviously has well-stretched muscles, and that's good. But, in bending forward to this extent, she's also pushing the jelly, which should be in the center of the disc, out of position. She will need to do exercises to reverse the effects of this position, or there is a very high probability she will develop back pain from the disc problem that she's creating. Good exercise instructors know this, and they do follow-up exercises to compensate for this extreme posture. In this picture, the red arrows point to the joints of the spine. Joints are those areas where 2 bones meet. The ability of joints to move freely without pain can be affected by many things. A few of the things that adversely affect joint motion are trauma, disc problems, poor posture, and shortened muscles. You may remember the 2 common causes of short muscles are trigger points and scar tissue. The joints of your body were designed to work together so that you can move easily without limitations. If one joint doesn't move as much as it should, a second joint must move more to compensate for it. Think about it. When you walk, the low back and the hip each have to move a little, so you have a fluid motion. They are linked to each other. If you have back pain, it may be because the hip moves too little. If you have hip pain, it may be because the back moves too little. Bottom line, if you have back pain, you must check the hip. If you have hip pain, you must check the back. When the movement of a joint is decreased, inflammation soon follows, which causes arthritis, which causes pain. As we can see, healthy joint motion is very, very important. To eliminate pain in your joints and to minimize arthritis, it is extremely important to maintain normal joint motion. Your body loves motion. You were created to move. Decades of research has proven that one of the most effective ways to regain normal joint motion is through chiropractic adjustments. By restoring motion to the joints, we decrease the inflammation, which can delay or prevent arthritis. As we've seen, by simply helping the joints move again, we can dramatically decrease or eliminate your pain. We've described the major causes of pain in the low back, hip, and leg, and those are trigger points and scar tissue and muscles, poor posture, the jelly moving away from the center of your discs, and decreased joint motion. Interestingly, there is one form of therapy that helps to calm, and in some cases correct, some of these causes of pain, and that is traction. This simple form of therapy relaxes muscle spasms. It helps to move the jelly of the disc back to its proper position, and it helps to restore motion in the joints, which decreases inflammation. When we use traction, we accomplish two things. We decrease your pain, and we slow the process that causes arthritis in your joints. Traction is a wonderful treatment with many benefits, and that's why I use it on most of my patients. You know, massage is a wonderful thing. It relaxes the muscles and it feels great. But I find that pain and spasms will often return quickly, unless four things are done. First, the trigger points in your muscles must be deactivated to stop the local and referred pain. Injured discs must be healed. Joints must be coaxed into moving again. And exercises must be prescribed to stretch short muscles and strengthen weak muscles. And this will help to make your joints more stable. Do these four things, and your muscle spasms will calm, and your pain will decrease rapidly. Do you have pain in your back, hip, or leg? Does it seem to be progressing or just won't get better? Well, perhaps you should consider an approach that combines soft tissue techniques with gentle, pain-free adjustments. This is the approach I take with my patients. Call and set up an appointment. I think it will surprise you just how good it feels to feel good.